Hello Nigeria, hello Africa is yet another exciting episode of the Voices for Self-Care, where we advocate for moving national policies for self-care from policy to practice. If you're just joining us, a warm welcome. Please do make sure to subscribe and hit the bell button to get notified anytime we make a new post. Now today we'll be talking about driving demand generation for self-care interventions, and to help us with this discussion is yet another special guest. We'll go on a short break right now, and when we come back we'll dive into it. Welcome back. This is the Voices for Self-Care podcast, the #1 show advocating for self-care in Nigeria. Like I said, we have a very special guest with us in the studio who is going to be talking about from policy to practice, driving demand generation for self-care interventions. Our guest today is the founding Director General of the West African Institute of Public Health, an adjunct professor and President Emeritus of the Academy of Public Health. He is a notable physician, social entrepreneur, and development strategist with over 2 decades of roles in development, private and public sectors, of which some were with the world's leading development organizations. With strong multi-country experience in Africa, he is a leading global voice for universal health coverage, health security, primary health care, and health technology. Within his robust career, he has collaborated with United Nations, agencies like UNHCR, UNICEF, WHO, as well as bilateral bodies like USAID and FCDO across Africa to improve the health of women and children in both development and humanitarian settings. My esteemed viewers, please join me in welcoming Dr. Francis Ohayindo. I hope I got it right this time.
Thank you very much. Ohayindo, yes.
Okay, I'm happy to hear that.
We'll keep working on it.
Yes, we'll keep working on it. So backstage, I practice his name, Ohayindo. So did I get it right this time?
Ohayindo, yes.
Thank you very much. Dr. Francis, such a pleasure to have you on the show today.
Thank you very much. The pleasure to join you. And I think the topic in question is key, especially where we find ourselves. Post-pandemic.
Exactly.
Very, very important.
Thank you so much for saying that, because we're definitely going to talk about self-care post-pandemic. But first, we're going to start with the role of regional institutions in accelerating the adoption of self-care interventions. So as the DG of West African Institute of Public Health, what role do you see regional institutions playing in accelerating the adoption of self-care interventions, particularly given that Nigeria was one of the pace setters of self-care implementation in Africa? So what role do you see regional institutions playing?
All right, thank you very much. I think it's no brainer to say that regional institutions first and foremost have to be the bearers of the concept, because it's important, because the organizations like mine are first and foremost we're a technical body to start with, so we should be knowledge gatherers in the sense of the word, and what we do is gather knowledge and share it, so that knowledge can inform policy in every sense of the word. We're talking about policy to practice, so in that sense, regional bodies like mine, one of the key things we have to do is to be able to begin to do more research, gather more evidence around self-care in such a way that we should be able to share what is good practice. And so self-care is basically a concept that's been with us for forever, but we have only become very conscious of the idea of self-care post-pandemic, because a lot of things that happened during the pandemic, people were on lockdowns, people didn't have access to usual care, the traditional care as we know it.
Yes.
So people had to now resort to self-care in a sense, to be able to get by in terms of their health and all that. So especially for women, and children, so that's very, very critical. Having access to the right commodities and also taking them effectively without the presence of a key provider in your business. Except some of them were able to engage them through technology, channels and all that. So it becomes very clear that regional institutions should be at the forefront of this pathfinding in terms of getting the information, sharing it, and also one of the things we do is being a technical body in terms of technical assistance.
Okay.
It is one thing to get the knowledge and share it and warehouse it for others to be able to access it. But it's a different thing for you to get the people to gravitate around it in such a way that they understand it and use it. So we can be technical assistants, we can support countries, we can support organizations, and even communities to better harness those information that we're talking about and use them.
Amazing. That is very good to hear. Now, speaking of information, Dr. Francis, the National Demand Generation Strategy document highlights health literacy as one of the barriers for self-care adoption, across Africa. So from your perspective and from, of course, the Institute's perspective, what approaches would you say, or could you say that West African countries could employ to improve this health literacy around self-care?
Okay.
Now, not just self-care generally now, self-care for sexual, reproductive, and maternal health.
Okay, so for SRMH, so I want to step back and say, in fact, for Africa, because the idiosyncratic situations are not so there are nuances, but they are almost similar across Africa, especially most of Africa towards the southern part. So we share a lot of those things. So I won't just restrict it to West Africa. But I think if we talk about health literacy, I think I consider myself one of the people that have been pushing for health literacy as far long as I can remember. One of the programs the Institute organizes is a leadership program for young professionals in health literacy. We call it the Health Literacy and Leadership Program, HLIP. It's one of our bouquet of programs to drive a new thinking around engaging communities through health literacy and building their health literacy. Because the truth of it is that people can only use what they know, and people can use them better if they are literate to a level where they can be able to apply that knowledge. So health literacy becomes very key, especially community health literacy, because we still live in a place where we have extended family systems, we are communal. So building health literacy has to be born or within a community framework, so that communities can take it better, so people can understand what you're talking. And evidence shows that even during COVID, even during Ebola, that communities that were able to gravitate around common understanding around the issues did better than other communities that didn't. So it becomes very critical that we need to harness approaches and strategies that can improve health literacy. One of them is at the forefront of it that comes to me quickly is health technology. Okay. Health technology like mobile health, for example, can be key. I sit on in fact, the Institute is part of what is known as the Africa Digital Health Networks, which is a movement created by the Africa CDC. And what we're looking at that is creating networks of people and organizations that begin to understand the importance of digitization for the continent as a way of leapfrogging some of the issues that we have within the health system. Because that's it. Technology can help you jump some things that are obstacles. If there's no doctor, for example, is it possible to talk to a doctor through WhatsApp? Is it possible to do something as simple as WhatsApp? Can engage a practitioner. It was done during COVID. So those things become very key. So technology is key. Policy is key, making sure that we build a health literacy system that is imbued within a pandemic framework, a pandemic response framework. Because the problem with health literacy is that if we don't build health literacy for healthcare, for self-care within a pandemic framework, we lose sight of it when pandemics come again. Yes. They will go back to the same thing again and begin again to see how we can build communities, but once it's there as an integral part of it, you find that you're able to engage communities early enough with the ideas around health literacy relating to self-care to make sure that SRMH works for their betterment, So that is very, very important. Then the other thing about health literacy is the fact that you need to build capacity of health workers to be able to understand the nuances of building communities, and that's what we're doing at the Institute. We have graduated possibly over 1,000 young professionals in public health who understand health literacy, and not just health literacy for health literacy, because health literacy at the level, like I said, can be at the individual level, it can also be at community level, and it can be in the larger social science of it. So we build their capacity to understand the community level, because Africa, community is everything for us. So if a community understands the issue around self-care, they are better able to run with it rather than the individual alone. That Ubuntu concept, I am because you are.
Yes.
You understand? So that becomes very critical. Then the other thing too about it is to make sure that our policies, beyond the pandemic response thing, that our policies look at low-hanging fruits from community assets, things that are appropriate for communities in a way that engages them better with self-care, for them to see it not something that's coming from a highfalutin end, but something that they can relate to in a way that makes sense. If you do it that way, health literacy becomes an integral part of their everyday existence for self-care. So they don't see it as something that is easy, or they won't fight it. Because they tend to fight what they don't.
They don't understand.
Polio had issues because people didn't understand why every time they had hospitals and people were coming to knock on their doors, they want to vaccinate people. They didn't know it was meant. It meant to work, but they didn't understand. There was an agenda.
Yes.
Which was not true. But they fought it. People fought polio for all sorts of reasons because of what they didn't understand.
This brings me to my next question. You've touched a bit on it, but for the sake of emphasis, I would like you to talk about leveraging the interconnection between individuals, community, structures to creating sustainable self-care interventions. Because yes, you had earlier spoke about the importance of these community, individuals and health systems working together for health literacy. But just for emphasis sake, could you still talk about, based on the socio-ecological model that was talked about in the strategy document, tell us how we can actively leverage individuals, community, and structural levels to create sustainable self-care interventions.
Okay, so I think in passing, I've actually around
yes.
But I think the first thing is that we need to understand that if you are using a social ecological model, you have to first make sure it's people-centered. One, it's about the people. So everything, your plans, your strategies, all the interventions should be about people first. So even designing the framework should be what you call human-centered design approach, so that it talks about the people first and let the people make their input, so that the people are carried along ab initio from beginning in terms of designing those strategies. Because if you don't do that, they get lost and you have to go through the process of trying to bring them on board, and then the issue of trust comes in. What is your agenda? And especially in a society where people no longer trust politicians. Politicians are seen as synonymous with governance. So when government brings ideas or strategies, people tend to be very suspicious of them. They just think somebody wants to rip them off somewhere, but which may not necessarily be true. So it's important to get the people on board very early. That socio-ecological model gives you a framework to engage from the individual to the community level, and then to the larger levels of the system. And larger levels of the system means that you have to engage with the health system. One of the things that has to come in clearly moving forward is something that the Institute has been pushing, is the idea of health in all policy. Health in all policy means that for everything we're going to do, let's say Wike, for example, in FCT in Abuja here wants to do a road, and the FCT, Federal Capital Authority, has to create certain policies to engender those kind of things, right? He should probably ask himself with his team, what will be the health impact of this thing? If it's a capital project, what will be the health impact of this capital project? So that in everything we are doing as a people, we need to be looking at it from health in all policy framework. And self-care should become very key in all that whole arrangement. So social ecological model means that we're not just thinking in silos. We are thinking in that nexus between the person, the community, and the levels of the health system. And key to that is strengthening health system. The more we strengthen health system and have community voice accountability as a response mechanism for the health system, you will be able to get a pulse of what the people feel about what is happening within the health system and make sure that it works better for them. Because if people give you feedback, you're better able to know your shortcomings as a provider. So it is not just to look at the demand side, but also the supply
Supply,
side. The
course.
two must meet within the enabling environment so that there is an information loop that feeds back to make sure that both parties are working within that system in a way that there is a socio-ecological model that can give you a good framework for that.
Very interesting.
Yeah.
So from your experience, Dr. Francis, what opportunities exist for public-private partnerships in scaling up self-care interventions in West Africa?
Okay, back to what I said earlier, Africa.
Yes.
Okay. Yeah. So
okay,
for
in
me,
Africa,
in
you don't want to
yes.
speak. Oh,
yeah,
okay.
Yes. Over time, I've learned not to restrict it. In fact, like the institute, our academy that we have in the institute, we no longer call it
West African, okay.
We call it the Academy of Public Health, which is a flagship of the institute.
Okay.
Because of that, we are responding to Africa.
Okay.
The whole sense of we are together in this.
Okay.
We're a common continent. We're common people. We should shape our agenda in a commonality that speaks to our needs as a people. So the Ubuntu thing, or what the Igbos call Igwebike. Igwebike in Igbo is the concept of togetherness. The idea that if you take a broomstick, you can bend it and break it. But if you take a bunch of, look, it's difficult. It's almost like a tensile iron. You know, so for us, the idea of public-private partnership, let me also add people partnership.
Okay.
Public-people partnership is very key because it's about the people. And one of the things private sector can bring into this whole thing is energy. Energy of private sector.
Okay.
Private sector tends to run faster than the public sector because it has a lot of energy.
True.
And because energy is important to move from inertia to action, private sector can imbue the system with an energy to help ship things from one point and move the needle a bit faster than when only government is doing it in its own bureaucratic way. Then the other thing private sector can bring in is financing, funding. There's a lot of money in private sector in terms of even philanthropic money. We have all the Dangotes, we have the Aigemoku days, we have all of them within the system. But the point is that some of them, we have not made cases to them about key interventions within the system that they can support in a way that will bring good return on investment to the system, not just to them, to the system. Because if Nigerians are better and well and working very well, companies working in Nigeria will do better.
Yes, because they'll have more.
Yes. So that return on investment, that's what people don't understand. $1 you put into the economy, we give you probably about $14 or $19 down the road, depending on how good your system is. So that it is not wasted money when you put money in health. The more health you get for your money, the more propensity for your health system to drive an economic growth for you. So it's very important. So self-care becomes very critical because the individual needs to know that they have something to offer.
Yes.
And self-care enables them to be in a better state to be able to apply themselves to the system. So that's very key. So private sector, again, brings funding, like I said. Private sector funding can be catalytic. It is not going to replace government. It is to support government, to deepen programs so that programs like self-care can reach underserved communities where government is not able to reach. Private sector can bring in its capacity and technical skills too in things like logistics chain management. One of the biggest challenges we had during COVID or in pandemic was the dearth of good ability to manage resources in terms of logistics because a lot of things were shut down. You know, a lot of drugs didn't get to the right people. Communities were not able to access the kind of commodities they needed. You know, it took a lot, even globally, a lot of things couldn't leave China.
Yes.
Things that were being produced in places like China. And so it affected the world because of the logistics side. So private sector nimbleness and ability to understand logistics systems may be something that becomes critical in driving a self-care agenda in such a way that the hard-to-reach communities are able to get. After all, Coca-Cola is in every community in the world.
Yes.
And we don't ask ourselves how Coca-Cola gets
logistics.
In the world. Meanwhile, we say, some drugs can't get to this community. But how did Coca-Cola get there? So we need to learn those things and be able to apply them. So private sector knowledge and experience becomes very handy in terms of driving that, like I said, energy and movement for the system.
So yes, I agree with that, but I want you to emphasize on the public sector as well.
Okay.
because yes, we talked about private sector and having logistics and energy. So, but let's tie it to partnerships with the public sector and with the government. Yes.
Okay, so it comes to basically what I just said. So I talked about funding. So private sector can support government through catalytic funding, like things like expanding social health insurance and seeing that more people are onboarded within a social insurance framework where universal health coverage systems are expanded so that people are covered more to be able to access some of these things. The other side of it too is that private sector can be an advocate.
Yes,
for
not
self-care.
leaving it
not only just leaving it to development partners,
yes, development partners and
other non-state actors. Private sector can be part of that advocacy push because government respects private sector, especially if it's a strong, organized private sector. If a Dangote walks into the presidency now, sorry, I'm using Dangote's name, but Alhaji is a very strong man. So, so if he walks into the presidency now and said, oh, look, self-care is a very important thing. I'm an advocate for it. Everybody will listen to it.
Yes, because of his influence.
Yes. So that's the kind of thing we're talking about.
Okay.
So that agenda to be able to influence things for public good is something private sector can do through even that partnership. So partnership is a broad thing. It includes collaboration. It includes being even with a coordination mechanism. It includes being able to have like sort of an agenda, a common agenda. So the partnership we are talking is very broad. It's how we define it. And the self-care community in pathfinding and moving forward needs to be able to clearly understand that it has to engage every stakeholder across board through partnership to be able to drive the agenda. Was there something else you wanted to say?
No, definitely not. Thank you so much, Dr. Francis.
Yeah.
Thank you very much, viewers. And coming up next is Self-Care for UHC, implementation of self-care at the primary health centers, and more details about the National Health Forum right after the break. Welcome back. This is the Voices for Self-Care, where we advocate for moving national policies from self-care, from policy to practice. We have in the studio Director General of the West African Institute of Public Health, Dr. Francis Ohayindo. Welcome again, sir. And we have been speaking about from policy to practice, driving demand generation for self-care interventions. And Dr. Francis has given so many insightful opinions on the topic, and the show continues. Now, Dr. Francis, we've been talking about driving demand generation using the National Strategy document on demand generation. And that document outlines an implementation, phased implementation approach rather for demand generation. So my question to you is, what are the key success factors, or what key success factors should countries consider when adopting and implementing similar strategies, in their local context?
All right. So that's very, very important. Like I said, because of my talk, I probably alluded to some of those things, but now let me bring them together and sort of ring fence them. First thing countries need to do is to make sure that it's about the people. So context is very important. Kenya is not a Nigeria. In as much as I keep talking about the Africanness, the context becomes very critical, because what you're doing depends on the people's way of looking at things. So your success will be gated through how the lens the people look at things. So that's one. Then for success too, you can also look at how much capacity have you built to be able to run with it. That's very important, because if you don't have the capacity to run with your strategy, you will have a problem. Your success rate, it will be what you call in science a rate limiting step for your success. Then the other thing about success here is how much access is this document at ground zero of implementation. The success will depend on if I walk into a local government's chairman, an Argon member now in any council in Nigeria, out of the 774 local government areas in Nigeria, plus FCT has 6 area councils, so that let's say 780 LGA-like structures in Nigeria, and I walk into any chairman's office, I should be able to see a document on somewhere there that speaks to it. And when you go to the level of care, the provider should have seen the self-care document.
Okay, so
those things define success, because if whatever you do does not get to a level of implementation, ground zero, your success rate will be limited. So that's very important.
Yes, so we're going to get to that, especially primary health care centers. But I would like to state that currently Nigeria has a national self-care guideline that was developed in 2020, and it has been disseminated into 25 states. Currently, Lagos State has domesticated the guideline, and also Kaduna State has recently validated the guideline for domestication, which is a success story. Now, we're going to talk about implementing these guidelines into the primary healthcare centers. So how can we institutionalize self-care into the primary healthcare centers and actually implement them at primary healthcare level?
Okay, yeah, so unpacking that, we have to, like we are still talking about what is success, how do we see it, is the fact that you will have practitioners who have capacity to deliver on self-care, make sure that communities understand this self-care. And our primary healthcare structure is such that within the primary healthcare structures, we have community health extension workers. Ideally, they should engage with the communities that they subside within that catchment area. And the capacity to understand how to engage these communities and make them understand the value of self-care becomes very important. Because one of the problems with self-care for people who don't understand self-care is when they hear the term self-care, they think it's just an autonomic system that is independent of the health system. It is not true.
No, it's not.
Self-care is actually a strategy that connects you to the health system in a better and in a more robust way in case there are challenges within the health system. So you're able to access certain services without always having to
visit the health center.
But ideally, people should go to the health system. That's why it's important for people who also are providers in the health system to understand that's what self-care is and how there's a nexus between the health system. So capacity is one.
Very much.
And then how do you even build capacity? So for example, the CHUs have what you call standing orders. That is the basis of their clinical diagnoses and all that. So self-care should be integrated into the standing orders. If you don't have it in standing orders, the people who man primary health care majorly in Nigeria CHUs and JCHUs and all that, community health extension workers, you will have challenge because a lot of them will not have it in their what do you call it, in their in-service work, where they are able to access that information as part of their training and part of their understanding of continuous development. It becomes very easy. So the other side is pre-service. Before that, we need to also have it in the curriculum of institutions that train professionals in the health system, whether doctors, nurses, anybody, pharmacists should understand what self-care is and understand that it's something within the health system. It is not something hanging outside the health system. So the understanding of it and how to make it work better for the community and the individuals within the health system becomes very critical. And then so at that ground zero of implementation, those things become the key success factors. How you're able to get the community to uptake it. And it's dependent on all those factors I've mentioned.
Thank you very much, Dr. Francis. This has been a very enlightening and engaging session. But before I let you go, I would like us to talk about the National Health Forum that the Institute is planning and how you plan on integrating self-care interventions or self-care conversations into the forum. Could you please give us more details about that?
Okay, so it is not even a national thing. It's an African thing.
Okay.
So we're organizing an Africa Primary Healthcare Forum, which looks at primary healthcare. So the challenge with primary healthcare on the continent is diverse. It's as diverse as how many languages you speak on the continent. But the issues, there are certain key issues that are common for primary healthcare. And we want to bring stakeholders to Abuja in July from every facet of Africa and every sector to look at how do we reposition and revamp primary healthcare, because it's the cornerstone of the health system. Since Alma-Ata in 1978, the world came together and said, look, health systems have to be built up from primary healthcare as the cornerstone of the primary healthcare system. In 2018, we still went to Kazakhstan to Astana and reinforce that idea that primary health care is the foundation of health system. So in Africa, how far have we gone with primary health care as the foundation of the health system? But we are not being very overly ambitious, but we want to be able to focus on things and not have a talk shop. We want people to come and let's look at evidence and metrics of what has happened in primary health care. So at the end of the day, whatever we're able to generate can influence policy down the road and also feed into the work of like Africa CDC, governments across the continent to be able to shape the conversations and the policies around primary health care. So for us, we are looking at three main things, thematic areas. The first thematic area we're looking at is the issue of post-COVID reflection. That brings self-care. People-centered primary health care system. Issues of nutrition in pandemic. Issues of even infodemics. As you know, I'm sure you saw people putting bulb on their shoulders and saying that they took COVID injection and a light bulb now started working on their shoulder. All sorts of things that came up. All sorts of stories that were not true, came up during this. And these are part of infodemics that accompanied the pandemic. How do we better manage this thing? More people are saying, no, I don't want my child to be vaccinated because they are hearing all sorts of things, all sorts of stories which are not necessarily true. How can we manage these things better? So we say the post-COVID environment, can we discuss it and see how we can do better with it? Then the second thing we're talking about is health workforce. How do we make sure that the health workforce that currently exists, we are talking about self-care and the capacity and what is success story, for example. How do we make sure the health workforce understands self-care and they can apply it in SRMH in their daily work and service delivery? Very important. How can we digitize health workforce? Because I talked about technology. I've always been an advocate for technology. Technology can help us. And this is the age of AI. There are some things that we should not even be talking about in the health system. When we have phone, you have all sorts of interfaces that you can engage with. And you are still doing things as if you are living in Stone Age. We need to improve on that. So digitization of the health workforce, health system, point of care, very important for primary health care. Then we're also talking about even how workforce performs in pandemics. All those things are there.
I'm sure.
Then the third one, so I'll close shop here. Third one is we're looking at partnership. You mentioned partnership around self-care. So partnership around primary health care. How do we make it work for the benefit of that woman who is selling akara by the roadside and her children? How can we make sure that it works for you and I? That if an Obasanjo comes out of Water Farm, he can walk for 10 minutes, 5 minutes and get treated for uncomplicated malaria in a primary care facility near Water Farm. That is what we want to be talking about. How can partnership drive it? How can private sector energy? How can private sector capacity? How can development finance? How can philanthropy? How can all that come? How can even people volunteerism, as simple as it sounds, help drive an agenda to reposition primary health care? That is where we're going with this.
That sounds like a full power-packed conference on health, and it's exciting to see. So I'm just going to ask you, Dr. Francis, has active plans been put in place? Is there a date fixed? How do we attend the conference if we want to attend the conference? Is there a fee? Just give us more details about that.
Okay, so there's a date fixed. We're looking at the conference from 8th to 9th of July this year here in Abuja. And also back to back with the conference. There's a conference again following it that we are also a partner. The Africa Health Symposium, which has been going around Africa, is Africa Health Business Symposium. It's called the Business of Health. How can we do it? So 8 to 9 is the Africa Primary Healthcare Forum. 10, 11 is the Africa Health Business Forum, and they are back to back here in Abuja. And we are hoping people will come from different parts of Africa. So if you want to come for the conference, I mean, you can send in abstract. There are all sorts of things, speaking opportunities and all this. There's a website. The website is simple, phc.africa.
phc.africa.
That is acronym, primaryhealthcare.africa. That's the website. And yes, it's a paid conference and it's not heavy lifting in terms of payment. There are different categories based on what we call high income countries and low income countries, low and medium income countries, brackets. And then even people who are alums of our institute, basically the opportunity for them to attend almost at giveaway, this thing. The idea is that we also want the conference to be self-sustaining. We don't want to do a freebie where tomorrow there will be no conference again. But we want it to be such that we're able to galvanize the kind of thing that also has value. Like I said, it's not a talk show. We want partners, and White Ribbon Alliance is going to be one of our catalytic partners for the conference. So we're looking forward to having all the right stakeholders to begin this walk the talk, as you say.
Yes, walk the talk. It has been, thank you so much, Dr. Francis.
Thank you very much.
It was such a pleasure having you here today.
My pleasure too.
We've dissected the concept of self-care and demand generation. We've spoken about private-public partnership. We've spoken about the intersection between individuals, community, and of course the structural system. And of course, it has just been impactful and enlightening in general. Thank you very much. And to you, my esteemed viewers, many thanks for joining in. Many thanks for staying tuned. And I hope you've enjoyed watching the show today. If you have any questions, please do make sure to send your questions in the comment section or send us a mail at rancoms@gmail.com. That is WRANCOMMS@gmail.com. I'm your host, Oyari, and I'll see you next time. Bye.